Welcome again to our prescriber spotlight. Mike Collins here from Healthway Compounding Pharmacy, joined again with Dr. Olivia Phifer-Combs.
Hi.
Welcome. How are you?
Thank you. I'm doing well.
Good.
Thank you so
good.
much.
So this is another one of our segments on women health. Only this one we're going to talk a little bit about lactation. It's a really important topic, and so I hope that you're able to glean some tips and information that Dr. Phifer-Combs is going to give us on. So tell us, when a woman comes to you, what are some of the issues that you run into with lactation?
I'd say probably the most common issue, one would be lack of supply. Another one would be difficulty with latching. So moms just trying various positions and just having a hard time with baby latching to the breast. And then probably the most significant one would be patients having very painful type of sensations when they are trying to breastfeed the baby, and it's just very uncomfortable for patients, and
Sure.
trying to work through that.
Well, let's talk a little bit about supply first.
Okay.
So talk to us about how would you help a woman create more milk supply?
So a lot of the stimulation of this is with baby latching, because when the baby latches actually to the breast, it stimulates a hormone to actually produce more milk. And then afterwards, when the baby is actually trying to feed, is what creates dispensing that as well. And so a lot of it is about the stimulation with mom and baby, and the more that you stimulate the breast, whether it's through pumping, because you have working women that aren't
Sure.
able to actually breastfeed all the time, which is completely fine, along with actually women able to breastfeed, and that stimulation, and that is how kind of this cycle works.
Perfect. So so what other resources do you have as far as helping women with that technique? Because it sounds like it's the technique. And I have a daughter that just delivered my first grandson, pregnant with my second. So she breastfed for 6 months. She happens to be a pediatrician too. So she is a big proponent of breastfeeding. But what else in our community and even in your office, you help these ladies with support with technique?
Well, honestly, it's a matter of bringing the babies in.
Okay.
We have at our office at any time, any of my patients could come in, show the technique that they're doing, can help with different positions of the baby, how the baby's latching. But then also here in town in Saginaw, we have Covenant Healthcare, which is where we do most of our deliveries. And they have an amazing resource of a lactation consultant. And even the lactation consultants will work with the women after they deliver. But then also, at any time after the delivery, they can actually call the hospital and set up a personal appointment, so that they can bring baby in and work through that technique. Through personal experience, that's something I did after my first delivery, because it was something I was passionate about and was having a little difficulty with it, and brought my son over there, and we worked through that. But then I also had issues with pain, which I used some of the creams that are out there, but then actually went to one of the creams that you have, that really helped a lot with that. Do you mind sharing that a little bit?
No, not at all. And obviously that was one of the issues that brings patients to you, is they'll stop breastfeeding because of pain, right? And so what we have got is a situation where you've got skin that just gets broken down, right? And it gets irritated, just like if you would scuff your knee on the sidewalk. So that's going to be painful, and you're not going to constantly want to be trying to breastfeed on tissue that's really irritated. So we make this product called All-Purpose Nipple Ointment. We've been making it for 30 years. It's incredible. My daughters use it. Hundreds of doctors have used it. All kinds of patients have used it. And usually you just apply a pea-size amount to the either affected nipple or both nipples, kind of after each feeding, usually 4 or 5 times a day, kind of at least. You don't have to wash this stuff off. It's not going to be harmful to the baby at all. And it just helps to heal the skin. And most of the women that I've talked to, usually within the next day, they're starting to get relief. And there's no anesthetics or nothing to numb up the tissue. It's just helping to heal the tissue naturally with some antibiotics and it's really a great tool. And we don't want women to stop breastfeeding because it's painful.
And that was, through personal experience, you're dealing with so much right after a delivery, obviously learning a new baby, learning a relationship, also a family, and then add on the stress, if you choose to, is to breastfeed. And one thing that gets to be really bothersome is the pain. And so it's a matter of kind of working through. Every woman has various struggles of what they deal with breastfeeding, and it's a matter of working through that. And that's why it's so nice to know that there are other options out there that I personally use with you, that worked amazing. And rather than feel defeated and stop, you kind of use these resources to help you get through there, especially when you're so passionate about still wanting to do it, since it's a great thing for baby and also both mom.
And very cost effective.
Yeah,
a lot
very
cheaper than formula.
Very.
And you
yes,
make it. You make it
formula's
yourself.
Very expensive. Yes. Yes.
Oh, that's really good. So other things. So we know technique is really important to increase milk supply. Are there other things? I mean, a lot of times patients will come in to me looking for certain types of herbs or different types of vitamins that will kind of help their milk supply. What's been your experience on some of the other things? We know there's a prescription drug that we occasionally will use.
That patients that we can prescribe to help with milk supply. We first kind of recommend trying the natural type of stimulating ways with baby, just because when you start some of these medications, you have to also wean patients down on them, because then the body will become kind of dependent on some of these medications with the milk supply. I know there are some herbs out there, some teas, just haven't been well studied. If they work for women, that's perfect. It's just probably our first line goes back more to those natural ways to help. So, yeah. Perfect.
All right, so we talked about the support. We talked about some of the issues that they can have with not only milk supply, but also with the latching techniques, and then possibly any issues they might have with the skin breaking down and causing pain. Yep. So those are good. Is there anything else that you want to talk to women about and help encourage them to breastfeed their newborn baby?
I think that's probably it. I think it's just a matter of being very comfortable with talking to your provider after you deliver. Any questions, just never hesitate. I think, one thing we were sharing earlier is, we see patients usually for their 6-week postpartum, and one thing that I never want a patient to feel is that they had all these obstacles they were trying to get through but didn't know they had the resources. And rather than just stop breastfeeding because they feel like they can't, and when they really truly wanted to. Now, yes, some women don't want to do it. It's not for everyone, and that's totally fine. But it's just knowing that there are those resources out there, the ways that we can help.
Right. So if your pediatrician, who is also the person that should be helping to reinforce this same information, isn't helpful, then make sure that you get back in touch with your OBGYN.
Yep.
Excellent. Yeah. All right. Well, thanks for being with us today.
Yeah, thank you so much.
Thanks, friends. Mike Collins from Healthway Compounding Pharmacy.